Good morning, good morning, good morning. Hello, and welcome to today's Back to Basics show. I'm Rico Burton, and I volunteer with AARP Arizona. AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering people 50 and older to choose how they live as they age. With a nationwide presence and nearly 38 million members across the nation and approximately 900,000 members in Arizona, AARP strengthens communities and advocates for what matters most to families, health security, financial stability, and personal fulfillment. Now, in the month of April, the national focus is going to be on fraud prevention by providing specific tools and information to help consumers with knowledge and tools to spot and avoid scams. AARP is a wise friend and a fierce defender of consumers. The Fraud Watch Network is here providing free resources that will help you to spot scams, get guidance from fraud specialists, and help you feel more secure knowing we advocate at the federal, state, and local levels to protect consumers and enforce the law. Yeah, also in April, we're going to focus on how con artists operate and what you can do to protect yourself. Visit us for resources. Take a look at the links that show up on the screen below, and you can get the information that you need. We are so happy that you are here with us today. And we are with Coach Sherry Ann, and she is going to share some information with us today about how we can prevent chronic illnesses. Now, of course, we know that there's a lot to this, so let's dive right in. Good morning, Coach Sherry Ann. How are
Good
you?
morning, Lady B. I'm so excited to have you host today. It's really nice to have you here.
Thank you.
So
Glad to be here.
thank you for giving your services. The power of prevention really starts with awareness. And it's interesting because so many Americans, 4 in 5 favor public funding for prevention, and so there's a lot of resources out there and there's a lot of programs that are really aiming towards prevention because we become such a reactionary society as far as providing health care, and we want to get away from sick care and have a system that values and promotes health. And so but it really starts with not only what's happening in policy level, but we can take responsibility for what we're doing. And so as we're diving in here, I'm so excited to see all these people joining and letting us know
Yes.
where you're tuning in from, because it's always nice to see. So thank you all for letting us know where you're tuning in from. So chronic disease, unfortunately, costs most of the healthcare costs in the United States. 75% of it is from chronic illnesses. That's a lot of money that's being spent for chronic diseases that we can work really hard towards, preventing them, because lifelong, chronic diseases, lifelong disabilities, and they compromise our quality of life. So we're not able to live vivaciously and with a lot of just gusto. We're just slowly living our lives and letting things take over. And 1 in 2 adults have at least one chronic disease.
One and two?
Yes, have at least one chronic disease. And 4 out of 10 have 2 chronic diseases. It's it's things that we need to take responsibility for. And we'll dive into the things that you can do to help prevent chronic diseases. But 7 out of 10 deaths in America are from chronic conditions. And, so what is a chronic condition? So a chronic condition and a chronic illness is something that you've had for over a year and requires medical attention on a regular basis. So chronic conditions can be heart disease, stroke, cancer, diabetes, arthritic conditions, obesity, respiratory diseases, oral conditions, kidney disease. Like there's all kinds of things that people can have on a chronic basis.
Hypertension.
What's that?
Hypertension.
Oh, yes. Yeah. I mean, which leads to strokes. Yeah. So there's a lot of, and the function of, protecting and developing our health must rank even above that of restoring it when it's impaired. So if we can get to a place to where we are being more preventative and living a healthy lifestyle, that should rank above above all. And so preventative medicine is massively on the rise. Doctors, we need to have more doctors in the field that are studying preventative medicine and really helping at the ground level. And so there are a lot of things that are happening, that can help do that. But we as individuals need to take responsibility, like I said, doing, outreaches to people and exercising and educating ourselves and sharing what's happening. And so, like I said, we'll dive into that. But so what do you think is the number one cause of what chronic illness is the number one cause for deaths in the United States?
Well, probably heart disease. I want to. Okay, it is. I was also going to say hypertension because it's the silent killer. But okay, heart
Right.
disease.
It is heart disease. So hypertension, which leads to strokes, that's number 3. Those two together are 30% of all mortalities. That's a lot. Yeah, but heart disease is our number one killer of chronic disease. And number 2 is cancer. And it's usually lung or breast cancer. Those are the two most popular, or not popular, I should say, but the two most cancers that are causing death. And so cancer is number 2. So it's heart disease, cancer, and then stroke, hypertension.
Is that for men and women? Those
Yes.
numbers? Okay.
Yep. Yeah. And diabetes is taking millions of people. 57 million people right now, they're saying, are pre-diabetic. Pre-diabetic. So we need to be having screenings done and really taking an effort into our own well-being to help prevent these from happening. A lot of the reason why we have a lot of chronic illnesses is the lack of exercise. People are becoming more and more sedentary. And I know you've watched this show quite a bit. And those of you that are regular attendees know that I talk all the time about making sure that you're getting out and moving your body in a natural way. Like if you're a gym goer, great, no problem. But if you can get out and move naturally, at least 30 minutes, 5 times a week, you will increase your life expectancy, and in a good way, not just living longer in a chronic way, but living longer in a healthy way. So we just, as a society, are becoming more and more sedentary. We're a convenience-based society. And so people are, ordering their food, and just not moving as much. And not eating as healthy. So it's just start exercising. Some other causes of chronic illnesses, like I said, poor nutrition, just taking the easy way, and it's not as healthy. You're not getting the rainbow in, you're not getting all of your vitamins and supplements and, and minerals and things like that. Believe it or not, tobacco use is a huge proponent of a lot of the lung diseases, and which was shocking to me because I felt like we were, tobacco use has declined, but it's still so prevalent. And that is a major, major issue. And we really want to start taking issue with how we're raising the youth, because the youth have access to tobacco way too easy, and so they're going to have issues starting really early. But it's still an issue though, tobacco use. Excessive alcohol consumption. That can lead to all kinds of issues. We didn't talk about liver disease because it's not a common one, but it's out there, and so excessive alcohol also can cause other issues. So, it's okay to have your wine at 5. We've talked about blue zones and, the good thing about red wine, but excessive alcohol use is also a cause of chronic conditions.
Now, you mentioned the sedentary lifestyles that many of us lead, and part of what comes to my mind is, of course, the pandemic. When the pandemic hit, people couldn't go to the gym, and it was hard to know what to do. And depression is also a chronic illness for people who have been diagnosed. And a lot of that we saw during the pandemic. And you talk about nutrition, people were out of work, they didn't have money, and so they were buying foods that were high in carbs and all the rest, trying to feed their families. We've got a lot of underlying things that are going to preclude us from, making the best choices too. So I'm glad you're here with us today to try to help get us back on track, because I know I need it.
Well, what's interesting is you brought up is mental illness. There was a massive rise of mental illness during COVID. And I don't even think that we've seen the full wave effect of what's going to be happening because of that. But mental illness and chronic conditions are closely related. And a lot of that is because depression sets in when someone has a chronic illness. If they're constantly in pain or constantly having to go to a doctor, and their, their quality of life is compromised, they are going to start facing depression. And depression leads right into a host of other issues. It really exacerbates a lot of the chronic conditions that people face. So mental illness, depression, and chronic illnesses are very, very closely related. And that's one thing that preventative doctors are really focusing on now, is addressing that as a whole and not having it be a separate thing. Because Alzheimer's and other forms of dementia are the sixth leading cause of deaths here in America. And it's so unfortunate because there's so many things that we can do to prevent a lot of these chronic illnesses that just slowly creep up on us. And it's like, what's the phrasing of like slowly boiling a frog, or whatever. I don't even know what that phrase is, but we're just dying a slow death when you have a chronic illness. And so it's like, let's start, it's never too late to start. I always, say that it's never, ever too late to start making good choices that will give you a better lifestyle.
Thank you for that.
Yes. So they are preventable. I mean, that's the number one thing. And one of the biggest things that we can do is go do your screenings, go do your well visits with your doctors. I think, when we have children, we take them on this schedule of well visits for, the first few years of their life. And, and even the pediatrician's calling you going, well, you're due for a well visit, and we take such good care of our young people when they're coming into this world and making sure that they're healthy and they have their vaccines. And then we, turn into these young adults, and then we stop going and we don't think that we need to go. And going for a well visit and going for your screenings, that's one of the biggest things that you can do to prevent a chronic disease. Like, I'm 46 and I go for my annual mammogram every year. And even when they were like, oh, you can start coming every 5 years, I was like, no, because if I wait 5 years and you find something, and I could have seen it, 4 years ago, so, I make sure that I do my regular screenings, because there is breast cancer in my family. So I'm not going to, deny that. And that's the other thing, is a lot of people fail to look at their family history, and even when you're going to the doctor and they ask you a lot of your family history, it's important that you look at that and really address it, because that can be signs that will help you prevent, especially if you have issues in your family. So go for your regular screenings. Make sure that you're, if you have colon cancer in your family, and even if you don't, there's new improved ways for them to do colonoscopies now. So it's like, people are like always shying away from that. And it's like, no, do these things that are going to help you prevent, having to have a chronic condition later on in life, and diminish your ability to live vivaciously.
Now, there's a question that we have here going back to movement and the rest. And Belinda Young asked, when you say move naturally, are you saying that indoor exercise is not enough?
So Melinda, that's a great question, but I want to make sure I'm answering it correctly. So indoor exercises are enough, but it depends on what you're doing indoor exercises. And so, and there's a couple of different things to be looking at when I say move naturally, I mean, you don't have to go to a treadmill. You can go outside and go for a walk in your neighborhood, or gardening. Gardening is actually a really physical activity, because you're down on the ground, you're bending over, you're pulling, so that's what I mean by moving naturally. If you're good with your balance and you can go for a bike ride, go for a bike ride. So just doing things that get you outside, because also being outside gets you your vitamin D, which is really, really critical for your immune response. And so, but if you're doing exercises indoors, if you're doing weight bearing exercises, just body weight, like that's really critical for women, because as we age, our bone density goes down. But if you're doing body weight exercises, it's actually going to help maintain your bone density. So
what's a body weight exercise?
So like if you're doing, just body squats, like just standing, up and down, just doing, that's a body weight, or doing, assisted push-ups, like if you're doing push-ups with like your knees on the ground, or if you're not strong enough to do them on the ground, you can put your knees on the ground and do it against your couch, because then you're not full body weight of your whole body down on the ground. So body weight exercises is just using your own body. You don't need any weights to do it.
The nice thing about AARP is they also offer classes or Pilates classes that are virtual and other things that go right along and hand in hand with what you're saying now. So there are some resources that AARP is very aware of, thanks to you and others, that are going to get us out there so that we can make the movement. So Belinda, you make sure you take a look at what else AARP has to offer. There are classes and YouTube and everything else is out there. It sounds like, have to do it. And getting motivated to do it is part of it as well.
Oh, yeah, definitely. And so that's where having an accountability partner is so important. And that not only is that fun to have somebody to go do it with and that can hold you accountable and you're able to hold them accountable, but it keeps you socially connected, which you've heard. I mean, many people here have heard me talk. Staying socially connected is one of the biggest ways to fight dementia.
Mm,
So staying connected and having those relationships, that is probably one of the number one things, even like when I've talked about blue zones. Like it's such impressed, like they call it a MOI, but having a community of people that you can rely on and that can help support you be the best version of you. And then in turn, you're doing that. So yeah, if you aren't living with a partner, find someone that you can, a friend, a neighbor. It's so cute because I moved into a neighborhood in September, and I put myself out. I went and met my neighbors, like knocked on their door or caught them when they were coming in and out of their driveway, and so I'm friends with my neighbors. But
nice.
there's so many people in this world that don't even know their neighbors. It's like,
It's true.
just walk across the street. We're a community of human beings that are desire and need connection in order to have our well-being satisfied. So stay connected. So when you're doing your physical activity, look at it like you're going to be a catalyst for someone else and improve someone else's life. So invite someone to come with you.
Nice.
It's a great idea.
Thank you.
So other things, with diabetes, make sure you're getting those screenings if you have, issues with diabetes in your family, or, it's important to have blood draws every now and again and have your numbers checked, your cholesterol, your triglycerides. These are silent things that will sneak up on people. And all of a sudden they wake up one day and they're like, what is happening? And so make sure you're getting those screenings done, getting those blood draws every few years, and just making sure that your numbers are good so that you can stay on top of it. Because if they're not, making slight little tweaks in your diet will make a massive difference. Getting out and exercising will make a massive difference.
What can I do in my diet as a tweak that's going to,
So, do you eat all the colors in the rainbow?
not all of them. We all have colors that we like, right?
Yes. Do you get most of them? If you look at your diet like for children, I look at it like on a week, because children will get into these habits of where like they only want to eat the same thing, and the older they get, their palate expands. But you just look at it like on a week. So with adults, I kind of look at it on a 3 to 4 day, are you getting all the colors of the rainbow in at least a 3 to 4 day window? Just making sure that you're getting some blueberries in there, something blue, so that, because there's a lot of antioxidants and minerals in our fruits and vegetables. And so people have just, really slowly gotten away and from eating the colors of of the rainbow. And it's important to make sure that you're doing that. And, and watching your meat consumption. If you're not exercising and your body's not demanding that protein, then it's going to turn it to fat. It's not going to utilize it. So having a plant-based diet is good as long as you're making sure that you're getting all of your amino acids. So when it was like you asked, like, what's one thing I can do? I'm like, are you eating all of the colors, like in a 3 to 4 day window? If not, that's a good, easy one to absorb and apply to your lifestyle. Making sure that you're eating enough, believe it or not. As people, age, their diet, their appetite will be suppressed, and a lot of it sometimes can do with just depression, and so they're not even eating enough, and so that's kind of an issue with the elderly is just not getting enough nutrients.
Wow. Well, I don't know. We talk about eating all the colors. Colors can be costly. I think that's the other thing that people are looking at too. Is like, how do I do this and manage it? But I guess there's ways that we can figure it out, and there's help, like you say, from people like you that can give us some tips. So I will add some blueberries. Does it matter if they're frozen?
No, and I was just gonna say, like, if it's hard on your budget to do fresh fruits and vegetables, you can do frozen, because fruits and vegetables, when they're frozen, they're flash frozen. So they're frozen at the height of their, when they're most nutrient dense, if that makes sense. Because as a fruit or vegetable has been sitting on the shelf, it actually starts to lose the nutrient density to it. But
Mm,
frozen fruits and vegetables are frozen at the peak. So if you want it frozen, is actually a lot easier on people's budgets. So doing frozen is totally acceptable.
wonderful. Thank you.
Yes. I know some people, I mean, I'll do frozen fruit all day long because I add it to different things. But frozen vegetables, it changes the consistency for me on them. So I always tend to go definitely with the fresh vegetables, but fruits, I have no problem doing those frozen. Um, so my last tip is, and then we can answer any questions or, just dialogue about some different things, but is sleep. I've done a whole show on sleep. And for those of you that are tuning in, you can actually go back, and all of the shows that I've done over the last, I think I've been doing this now 2 years, are all archived. And so if there's a topic that you want to look up, you can type it in and back to basics in the topic, and it'll probably pull up a show. If there's not one, make sure you message me, because then I'll do it. Because I'm always looking for good ideas so that I can make sure I'm serving the community appropriately. But sleep is one that I've spent a whole show on, because sleep is so, so imperative. Because sleep is when your body is repairing itself and washing itself. Like, the brain actually goes through a whole process of washing itself at night and filing memories. And that's when your body's repairing itself. So if you're not sleeping appropriately, your body doesn't have the ability to do that. So it wakes up in a stressed state and it just starts all over again. And so that's a lot of the reason why sometimes chronic conditions come about, is the body is in a constant stressed state and it can never replenish and repair itself. So it just starts to break down, and it's going to find its weakest point to attack first. And so that's kind of how chronic illnesses happen. So if you can just really, really focus on your sleep, that would help tremendously. It also helps with depression. So it's in mental disorders and all kinds of things. So sleep is huge.
All right. There's another question here from Melinda that has to do with whether or not our grains and things have to be organic. Does that matter?
That is definitely a personal preference. No, they must not be organic. They don't have to be, especially with grains and legumes. The only thing that I impress upon people as far as organic goes is if you're eating the skin of the fruit or vegetables, try to stay away from stuff that does get sprayed with pesticides. Like apples, like we eat the whole apple, we get the skin of the apple. So we do buy organic apples, organic berries, because berries have, they don't have a smooth surface that you can easily wash. So like pesticides and things can kind of stick in the little grooves. And it's just a personal preference, because over time that does start to build up. But as far as his grains and legumes, that's not something that I would say needed to be organic from my personal preference.
Thank you. Now, let me go back to the sleep, this idea of sleep. I asked this question last month, I think, and I want to hear it again. And that is, for those people who nap or whose sleep pattern is off, how does that affect my health? And if so, how?
So that's a really great question. Napping during the day, there's nothing wrong with napping during the day. As long as you're getting your like 6 to 7 hours at night in one fell swoop. And the reason that is because our body goes through a whole cycle, a circadian cycle. And so there's a whole host of things that happen in that whole cycle. And if you are only sleeping 3 to 4 hours, you're disrupting it and you're waking yourself up. And so it doesn't get to go through that whole cycle. So, and that's challenging. I mean, and there's people you can talk to. They've done studies like firefighters, in paramedics, people that work 12-hour shifts, and their whole cycle's messed up. they do tend to have stress responses in their body, stress illnesses. And so it's because their bodies are just in a stressed state most of the time because they don't get to go through a full normal sleep cycle usually because it's really challenging for them.
Hmm. And I've read other places, so I know that there are some differences of opinions about this, that if you take a nap during the day, you get twice the benefit of what it would be at night. Do you not agree with that?
Well, how long of a nap are we talking?
Well, you know what? I said nap, didn't I? How about let's go to sleep? So if I go to sleep for about 3 or 4 hours during, 3 hours during the day, is that going
Well,
to
and
be
so you made a good point in that there's a lot of different information out there. And so, in all candor, everyone's rhythm is different. Like your sleep, when you go through your whole pattern of, when you enter sleep and you go from light to deep to REM and then you come back out of it, like some people that can last 3 hours and they can actually function off of 4 hours of sleep and be totally fine. the those people are not very common. They do exist, but they're not very common. So it just depends on your sleep cycle and if you're waking yourself up in the middle of the cycle, then it's completely disrupted and it was not beneficial at all whatsoever. You'll wake up really tired. And so that's why sometimes if people take a 2, 3 hour nap during the day, they wake up feeling totally groggy because their brain is like thinking like I'm supposed to still be asleep. Like I didn't make it through my entire cycle and you just completely ripped me out of sleep. And so that's why people will have that groggy feeling. And so and that's why a lot of people, and myself included, will say if you're going to take a nap during the day, take a 20-minute nap or
Oh, I'm sorry.
30-minute nap. And that's why they're called power naps because they just help rejuvenate you and then you wake up and then you're ready to go. Um, so you're not going into a full sleep cycle because it usually takes people about 18 to 22 minutes actually to actually go into a full slumber and then they might be going down into deep sleep. Um, but if you created a sleep pattern where you sleep 4 hours at night and then you go take a 3, 4 hour nap during the day, and that's how you have created your scenario, like you've just created that habit, then it will be hard to break it because that is your habit. Your brain is like, okay, like, because it goes to sleep. It's like, okay, I'm going to wake up 4 hours later. You wake up. And so I'm not going to deny the fact that there are people that can function like that, but the majority of the population cannot.
Okay. Hmm. All right, let's go back to some of the chronic illnesses you talked about. Diabetes is one, and I know that many people suffer from that. Is diabetes reversible? If we take a look at our weight and the foods and our sedentary lifestyles and the rest, can it be reversed?
Well, not type 1. Type 1 you're born with. Type 2, yes. I mean, it's that's a good argument to have sometimes with some doctors. Um, but yeah, you can absolutely, if you're really strict with your diet and you can get your insulin levels to where your body's actually monitoring it itself and doing a lot of diet, then yeah, you can. Or you can at least get it in a controllable fashion to where you're not going to be dealing with, eye issues and, foot issues, circulatory issues. And so can it be fully reversed? I don't have enough education to say that. I know that it can be slowed down tremendously.
Okay. And what about some of the natural remedies that we can use for, to prevent chronic illness? I guess some of them might be, like you've already mentioned, watching our diet, making sure that we get some exercise and our rest, of course. But are there a lot of other natural things out there we can do? Any remedies that you could
I mean, no, it's pretty much those things. Like make sure you're not smoking. If you're smoking, quit smoking. If you're a smoker, find a way to quit smoking. Find some accountability because within 2 weeks to 3 months, your risk drops significantly from having a chronic lung issue. Um, but and make sure your alcohol consumption is not out of control. It's very well monitored. But no, those are the basics, as far as preventing and then screenings. Like, so it's just making sure you're eating well, exercising, getting enough sleep, and go for your screenings. And have your blood checked every now and again.
Thank you so much for being with us today and for sharing all this wonderful information. We could go on and on, but our time is up, you all. Make sure that you take a look at some of the past episodes and come back next month where Dr. Sherry Ann or Coach Sherry Ann will be with us here with another wonderful topic on Back to Basics. Thanks so much for being with us. I certainly enjoyed our time together.
Thank you so much, Lady B.